Well, we were so glad to report yesterday that Damar Hamlin has gone back to Buffalo. His incredible recovery from suffering cardiac arrest a week ago Monday night continues. He tweeted today that he's not home just yet. He's still running tests in the hospital, but in Buffalo, doctors, though, say he's doing well.
It's insane when you think about it. It's a miracle, many of us believe, but Damar's life was saved because of quick and effective CPR. Dr. Kohli's like, yes, yes, learn more. Joining us, our 9 News medical expert, Dr. Payal Kohli. Also, she is a cardiac expert. You know, she is the best cardiac doctor in the country, right? What was the title? I forgot. I'm not getting it right.
You want people to learn CPR the real way, but anyway. But here is an opportunity for people to learn it just in case, the basics. So go ahead and take us through it.
We have to learn it. It is a service to ourselves, our community, and our family members. And as we said, it could save a life. So CPR, cardiopulmonary resuscitation, is essentially a life-saving intervention you do when somebody's heart stops. And what you're doing when you do CPR by compressing their breastbone against their heart is that you're actually beating for their heart. You're supplying blood to the organs, keeping them alive until the medical team can provide more definitive therapy.
And you do it right away.
Seconds matter. So the American Heart Association says if you find somebody down like this, you spend no more than 10 seconds looking for signs of life. So here's Anne. Meet Anne. She went down. So you rub her on her sternum. Anne, are you okay? Are you okay? She doesn't respond. You crouch over her, see if you see her chest rising. You can put your hand over her mouth to see if you feel any breath. And then you put your finger on her neck to look for her carotid artery.
That's where.
And you should feel it on your own neck to know where to look. And
only if all those are negative, do you start in on CPR?
Yes, because if they're breathing and they have a pulse, then you don't need to give them CPR. But if in doubt, Tom, you get on that chest.
Okay.
Because trust me, if they're alive and you start doing good high quality CPR, they'll wake up and they'll tell you that you're hurting them if you're doing it. So, Anne, 10 seconds have gone by. Kim, call 911. Tom, go get the defibrillator.
Okay.
And that means you need to know where it is.
Know where it is.
Exactly right.
Every building.
Meanwhile, you guys are getting it. I'm between her nipples, right over her breastbone. I put the butt of my hand and put the other hand over it. I lock my fingers. I lock my elbows and I lean over her with my upper body weight and I'm compressing that chest at least 2 inches. But then I'm letting up in the middle because you have to allow that heart to fill with blood before you pump for the heart again. And you have to do it fast. So Kim, I'm going to ask you to give me the beat of Staying Alive.
Oh, staying alive, staying alive, staying alive.
So you see how fast I'm doing that. And I have to do 100 to 120 per minute. You have to do it for 2 minutes continuously while Tom is getting that defibrillator. And then as soon as you get
so you, just so I'm clear, you're doing that all the way through the song. When do you wait for that till it comes up? When you say that?
Every lift.
Every lift.
Beat.
Every single lift.
Right.
Okay.
But that tune has to be that fast tune.
So it's a real aerobic workout for whoever's delivering CPR, and we've heard about it, even with experts, that it takes a team to do it.
It does. And as soon as you feel yourself fatiguing, don't be a hero here. I say, Kim, I'm tired. I need to switch
Somebody else jump in.
And then as soon as I lift up, you get on that chest because you want to minimize interruptions. Now, the American Heart Association has looked at children can actually do CPR. 6th graders, in fact, they studied.
Wow.
The majority of them can learn high-quality CPR. So this is something we need to learn how to do.
On this impact, if you're not sure, you probably want to be aggressive. You probably want to be hitting harder than you think is safe in some ways.
It's a lot harder. And if, there you go. And lock your elbows.
Yeah.
There you go. Do. Staying alive.
And faster than you probably think.
There
too.
you go. See how much faster it is? And so you do that for 2 minutes and you do it really fast. Now, if it's an infant who needs CPR, you're going to do the exact same thing, exact same ratio, but you're going to do only 2 fingers. Because their breastbone's a lot smaller.
Yeah.
If it's a child, you only do 1 hand. So it's exact same thing. Now, the American Heart Association has taken away breaths, rescue breaths, so it's compressions only if it's a stranger. But if it's a friend or family member who you feel comfortable with giving rescue breaths, then you do want to give those. So you do 30 compressions and then 2 rescue breaths. And the way you do the rescue breaths is you pinch the nose, you tip their head back, you purse your lips over theirs and blow in.
But 911 is really important. That's got to get started. Knowing where the defibrillator is. The AED is something we also heard a lot about.
Yes, automated external defibrillator. So now Tom has brought this. I've been doing CPR. Kim is opening it up while I'm doing the CPR, which shows us it's a team effort. Here are the pads, and it'll start talking to you.
Oh, it talks you right through it, so you can't really.
Everything.
Make sure 911 is called now.
Wow.
And it's
Begin by exposing patient's bare chest. Remove or cut clothing if needed.
So it tells you exactly what to do. And so, of course, these go on bare skin. You don't put them over the clothes. And you essentially want to cut off their clothing or take it off. And while you're doing all that, I'm trying to also do CPR on the patient. And where the pads go, one up here and one here, so that the heart is in between the electrical vectors.
So low on the patient's left side and high on their right side.
So not quite that low. You want it just above,
right in the waist,
just under the breastbone,
okay,
right there, and then here. And you can do front and back also, but sometimes it's hard to flip the patient. And it'll tell you whether you need to shock them. So let's say that they choked on something and their lungs gave way and it's not their heart, it'll say no shock advised. But if it says shock advised, then you charge it up, you step back. It shocks, it tells you resume CPR. So you get right back onto that chest and then you look for signs of breathing.
So most of the time, like if somebody's on the ground, then you get next to them while you're doing this?
You crouch over them and you get next to them.
Okay, not just like straddle somebody, because, okay.
Because you'll never get good quality compressions when you're straddling them. You have to be on their side. If they're on a bed, for example, significant other collapses, if you can, try to move them to the ground, because having that hard surface underneath them really helps you compress. If you're on a soft surface, it makes it a little harder.
Sure.
You'll have to push a little bit harder.
If somebody wants to take a class, how long does the class take? How can you sign up? It seems like they're pretty easy to find.
Straightforward. It's under an hour, and you can do it online. You can learn, and then, you know, whenever you have time, you can go to the YMCA, the American Red Cross, and practice on a dummy. But even if you don't have time for that, just learn online the basics. It can really be a life-saving measure. And we just had the holidays, and every year at the holidays, I try to teach my family, at least one member of my family, how to do CPR.
That's a great gift.
Well, I always think of it as something that, you know, some people may think I'm too busy, I don't have time, or someone else will know how to do it. And I always think of how would you feel if you didn't know how?
Yes.
And it was your time to step in.
Oh.
That would be no good. Thanks so much for showing us. All our viewers hopefully learned at least enough to, in an emergency, know what to do and theoretically get better at it and practice more. Dr. Payal Kohli, always good to see you. Thanks again.